Welcome to the Gerontological Society of America's Momentum Discussion, where we explore groundbreaking topics in the field of aging.
Welcome to this GSA Momentum Discussion podcast episode titled Nutrition Matters, Supporting Healthy Aging Through Proper Nutrition. GSA appreciates Haleon for supporting this podcast episode. My name is Jen Pettis, and I'm the Director of Strategic Alliances at the Gerontological Society of America, or GSA, and I'm pleased to serve as a host for today's Momentum discussion. I'm delighted to be joined by Dr. Roger Fielding. Dr. Fielding serves as the team lead and senior scientist of the Nutrition, Exercise Physiology, and Sarcopenia team at the Jean Mayer USDA Human Nutrition Research Center on Aging at Tufts University. He is also a professor of nutrition at the Friedman School of Nutrition, Science and Policy, professor of medicine at Tufts University School of Medicine, and the associate director of the Boston Claude D. Pepper Older Americans Independence Center. Welcome, Dr. Fielding. I'm so glad that you could join me.
Thank you, Jen. It's a pleasure to talk to you today.
Dr. Fielding, I wonder if we may begin today's podcast episode by setting the stage with some information about why older adults are at risk for nutritional deficiencies and inadequacies increasing as we age, including physiological, appetite, consumption, and other factors.
Yeah, I think the important thing to remember, and that's a really good question, Jen, the important thing to remember as we all age, because of changes in our body composition, we lose muscle, we tend to gain fat. Even if we maintain the same body weight, our energy requirements go down. And because of that, in many situations, it's very hard to consume a nutritionally adequate diet as the required number of calories we need to meet our energy demands go down. So correspondingly, the amount of micronutrients and other key factors in our diet, our intakes tend to be reduced a bit. So in some cases, we can put ourselves at risk for nutrient deficiencies. The other thing that happens very clearly, particularly in older ages, I'm not talking about people in their 60s and 70s, but maybe people in their late 70s, 80s, and 90s, and we have a lot of those people now. There are some changes in our perceptions of food and our perceptions of what we're eating so that their altered regulation of our appetite. So our appetite tends to go down, and maybe we don't think as much about food and eating as we did when we were younger. So sometimes there's some subconscious changes in our voluntary food intake because of these changes in appetite. So again, these things can place us at risk for specific nutrient deficiencies.
And you mentioned the food intake changes and perhaps decreases, but how about changes in energy requirements or other changes in dietary patterns that might happen as we age?
Yeah, and clearly there's also probably an increased need for some specific micronutrients. I'm thinking about calcium and vitamin D in particular, so that the requirements and the recommended dietary amounts for those nutrients in particular are upregulated for older adults, primarily because of the risks of decreases in bone density and the risk for osteoporotic fractures. There are some physiological changes in our bodies that require some changes in the requirements for specific nutrients. And there's also quite a bit of debate now about whether older adults require more dietary protein than young individuals. I would say that even though the recommended dietary guidelines for Americans has changed and recommended a higher protein intake, I think that the data on which that's based, particularly for older adults, is less clear. Certainly, we know that older adults that aren't meeting the dietary reference intake for protein, that somewhere around 0.9 or 1 gram per kilogram per day, those people probably need to supplement their diet and eat more protein to get up to that level. Whether more than that is better or not, I think it still remains a very open question, although there are varying opinions about that topic.
Given the changes, the decreasing calorie requirements, decreasing intakes, what foods should older adults prioritize to ensure that they meet their nutritional requirements?
Just like what your mother and your grandmother probably told you, we always recommend people eat a diet that's high in fruits and vegetables. These are food sources that are enriched with many micronutrients, B vitamins, other essential minerals. So those things are certainly good. We recommend people start with eating food, and then if they're still not getting enough nutrients from their food, then maybe you can start to consider dietary supplements and multivitamin supplements, for example. But food has a lot of things in it. We don't even know all the ingredients in many of the foods we eat, except that we know that they're healthful. The other thing we tell people is and the dietary guidelines are very clear about this now, we tell people to avoid processed and ultra processed foods, because those are usually very calorically dense, but they're not very dense in essential micronutrients and minerals. So their nutritional value is less, and they tend to have a high caloric density. And there are probably other compounds in those processed foods that are also detrimental to our health.
Dr. Fielding, we hear a lot about processed and ultra processed food. What do those words mean?
Yeah, there's no clear, really good, solid definition for those things, but typically it means foods that are somehow manufactured and made in a way that sort of changes their composition from their sort of original source. And I know that's not a very good answer, but things like cured meats, for example, very ultra processed cheeses, obviously a lot of snacks and high salt snacks and things like that. Sugar sweetened beverages probably fall into that category in a way. But you raise a good point. There's not, and this is one of the problems in this with the science right now, is that there's not a good absolute definition of what an ultra processed food actually is.
I think it's great that you mentioned the processed meats and the ultra processed cheeses, because I think people, as they are looking for protein, sometimes they're going to sources like that that perhaps shouldn't be their preference.
And there's always trade-offs. Overconsumption of those is probably bad, but small amounts in your diet probably are not as harmful as larger amounts. And there is an economy to this too, where processed and ultra-processed foods tend to be a little bit less expensive than fresh fruits and fresh vegetables, for example. So I think we have to weigh and balance those things so that people can afford the food that they eat and be able to get sustainable nutrition given the economics of food prices, particularly now where there's a lot of increase in the food supply pricing across the board. So
You mentioned a couple of nutritional deficiencies that are common in older adults. Are there any others you want to mention and share how interprofessional teams can identify those things and address those things together?
yeah, I think there's some evidence that there are deficiencies or low levels for some of the specific B vitamins. And we know that those are related to declines in both physical performance and muscle performance, and also have some effects on cognitive function and cognitive performance. Aside from doing a nutritional screen for dietary intake, there are several good laboratory measures from blood that you can use to measure levels of many of the B vitamins. That's more of a specialized analysis, but certainly it's something that if people are interested, they can have performed by their doctor. It's not always reimbursable, but many people want to know this information anyway, just to get a baseline and see where they need to intervene.
I understand that you serve in a leadership role in the International Life Science Institute's Healthy Aging, Sarcopenia, and Geriatrics work. Can you share a bit about that initiative?
Yeah, for a lot of my career, still now, I've been interested in how this age-related decline in skeletal muscle mass and function really impacts older adults' ability to function, get up out of a chair, climb stairs, walk, and live independently. And we call this syndrome, this loss of muscle mass, or this low level of muscle mass and function, sarcopenia. Yet when you talk to people, even when you talk to skilled clinicians and other healthcare providers, they don't really know a lot about sarcopenia, or maybe they've heard a little bit about it, but they don't know a whole lot about it. So one of the things that we've been doing with the International Life Sciences Institute is we've been trying to develop some programs to increase awareness of sarcopenia among healthcare professionals. And one of the things that we've developed to date, and this is not the only thing we're doing, but this is the thing that we just completed, is we developed a very short 60-minute webinar about sarcopenia, its implications, its consequences, and ways to treat sarcopenia, specifically for healthcare professionals. And what's unique about it, or at least what I think is unique about it, is that if you sign up and take this webinar, you can actually get continuing medical education credits for it, CMEs. And these are required training credits that I think virtually all healthcare professionals in the United States, at least, require. And we're providing this free of charge. You don't have to pay to take this webinar, and you can get the credits. So we're hoping that this is sort of the carrot, if you will, to entice people to watch the webinar and hopefully learn some good information about sarcopenia and then carry that into their practice. Now, at the same time, we also know that the public, older adults, their caregivers, their spouses, their children, don't know very much about sarcopenia either. So we're in the process of taking the next steps now and trying to develop some learning materials specifically for the public, for older people and other members of the public to also increase awareness of sarcopenia. So more to follow on that, but the webinar for the healthcare providers is available now, and I think you can find it, and we can share the link if we can, through the ILSI, International Life Sciences Institute website. And this is part of their healthy aging sort of program that they initiated a couple of years ago.
It sounds great. And you mentioned working on materials for the public. What's some key messages that you're going to include in that?
I think we've just started discussing these, but I think the message is going to be that slowing down and losing your strength is not a necessary consequence of aging. And if you begin to think that you're getting weaker and walking more slowly and having difficult with activities of daily living, as I mentioned, like climbing stairs or getting up out of a chair or getting out of bed in the morning, that these are signs that you may be having a problem with your skeletal muscle function. And these are things I think you should talk to your healthcare provider about and begin to have that conversation. Because while there are no pharmacologic therapies for sarcopenia, we certainly know that there are important lifestyle interventions that can help slow and even potentially reverse this process in older people. And I think without increasing awareness about this syndrome among people, we won't even get to the point of addressing what they can do to prevent or reverse some of these changes.
And what are some key things they can do to prevent it?
We've done a lot of studies over the last 30 years now showing that several different forms of exercise or increasing physical activity can have very positive effects on skeletal muscle health and performance. So even things as easy as walking 3 to 4 times per week, 20 to 30 minutes per session, can at least begin to slow the loss of muscle. And then if you really want to take an proactive role in reversing these changes, if you want to start initiating some progressive resistance or strength training exercises like weightlifting or using resistance bands or doing calisthenic type exercises, those clearly have been able to show the ability to increase muscle strength and increase muscle mass, even in very old individuals, people in their 80s and 90s. So I think without even thinking about medicines to treat sarcopenia, there are effective lifestyle interventions around exercise and particularly resistance or strength training exercise that can be very effective. We also have some evidence, particularly as I mentioned before, in those individuals that aren't consuming enough protein in their diet, that by increasing their protein intake, they also may be able to reverse or slow some of the loss in muscle mass and muscle strength. And then a bit more less common, if people have documented vitamin D insufficiency or true vitamin D deficiency, we know that vitamin D not only has effects on calcium absorption and calcium metabolism for bone health, it does have effects on skeletal muscle. So if you're in the deficient or insufficient range for your vitamin D, we believe supplementing your vitamin D up into that normal range can actually have some impact on your muscle strength and muscle function. So that's something to consider as well.
Well, my final question for you is, what's exciting? What's going on in research, evolving research around nutrition for older adults, and what are potential implications for care of that?
I think both in the nutrition and the sort of exercise sphere, and I think about those things together, nutrition and physical activity. A lot of people are really interested in this idea of precision nutrition and precision exercise, acknowledging the fact that there's a tremendous heterogeneity or variability in how different people, and in particular older people, respond to specific nutritional interventions. And we're learning now also to exercise interventions. So trying to unravel that heterogeneity of response and determine what factors influence it, I think may be able to help us better target the right therapy for the right older person. And that we're working on that. We have a very interesting project to look at that with respect to exercise and physical activity in older adults. And some of my other colleagues at Tufts are working on very similar studies trying to look at this heterogeneity, precision response to specific nutritional interventions. And I think that's going to be a very important area in the future.
That's terrific. Again, Dr. Fielding, many thanks for joining me today. And thanks to everybody who listened. Dr. Fielding, I always find it informative and enjoyable to talk with you. Thank you so much.
It's a pleasure, Jen. And I'm grateful that the GSA really spearheads and sponsors programs, podcasts like this. I think it's important for the field and for older people in general.
Thanks so much.
Check out GSA Enrich at geron.org/enrich for engaging learning resources, including toolkits, publications, webinars, podcasts, and more.